Okay, we can just do the general questions. Whoever wants to whoever wants to participate will participate. Okay, deaf persons use communication in their daily use dash communication in their daily communication. I think this is obvious. It's non-verbal. It can also be written, but I don't know, if you're not literate, then you'd rather use the sign language, but I don't know. What do you guys think? Malik?
Non-verbal makes sense.
Yeah. Okay.
Yeah.
All these are used in electronic media communication except there is personal communication, short message services, mini computers, and courier services. I think that's the right answer. Or
Yeah, but how is it pharmacy related?
I don't know, they usually ask computer questions as well. From what?
Okay.
Yeah. All right. The best method for disposal of radioactive pharmaceutical substance is landfill, incineration, dilution, and waste encapsulation. You can't put it in landfill, it will affect the soil. Incineration, when you incinerate, it pollutes the air. 1 minute. Dilution, I'm not too sure about that. Would dilution really, I don't know. Waste encapsulation.
I don't think it can be dilution because the radioactivity is still there when you dilute. So I guess D.
Okay. Okay, the following are members of pharmaceutical waste disposal team in the health facility. I think this is stage 2, isn't it? Because we did it in pharmaceutics with Calvin. I don't know if you guys remember.
Yeah.
Yeah, but we can always answer it. Or what do you guys think?
Yeah, there's no harm.
Okay, so pharmaceutical personnel, public health officer, medical officer of health, and procurement officer. So I guess it's the procurement officer, I mean. Or
Yeah, makes sense for the
'cause
procurement.
because all these guys know how to dispose the waste. Right? Okay, so which one of the following does not fall under the category of good housekeeping in pharmacy? There is tidiness, personal cleanliness, fitting of firefighting or something in the premises, and avoidance in eating in the pharmacy. Which one does not fall under the category of good housekeeping? Firefighting in the premises. Avoidance in. Okay. What do you guys think?
I think she's the answer. You're
Sorry,
right. The
C.
fire lighting one. Yeah.
Yeah, okay. Okay, the rest are not clear. The best what the hell? Okay, rating. Let me try getting paper 1. Okay,
Divya, we can do those matching ones because apparently they bring such questions. I don't know.
Okay, no problem. These ones?
Yeah.
Okay, match the following antihistamines with their chemical classes below. Estamizole.
Okay, I think this is like first stage, like paper 2.
2, yeah.
Yeah, just
Okay. You
it's
guys
okay.
are,
You can just go to the MCQs.
yeah, all right. Do you guys want to do anatomy?
Mm.
Okay. Cerebrospinal fluid is actively secreted by the choroid plexus. It's the major nutrition source of the brain. Has the same pH as the arterial blood. Contains virtually no glucose. I can't answer it somewhere.
A is okay. A makes sense.
Okay. Which of the following is not true concerning red blood cell production? Not true. It can occur in the kidney, not spleen. Increases during acclimatization to altitude is stimulated by okay, whatever that is, capnia, I think, is dependent on erythropoietin. Yeah, so B, is everyone okay with B?
Yeah.
Okay, all the following are secreted from the adrenal cortex except testosterone, aldosterone, angiotensin, and noradrenaline. Can someone please read? I'm finding it difficult to read. Kylie.
Okay, I'll read. Okay, so A, testosterone. Which of the following ions has
Hiram,
yeah?
I was wondering, like in women, don't they produce testosterone from the adrenal gland?
I'm not too sure about that.
You remember,
But
we have like, there are those 3 layers of,
yeah, but like if
yeah.
you're looking at the other 3 options, unless it's angiotensin, but isn't that also? I'm not sure. Wait, let's just check. Yeah, just search.
So I've seen angiotensin is released from the liver, I think.
Okay, according to what I've just searched, it stimulates the secretion. Aldosterone
Yeah. Yeah, when we look at like the RAS system,
Ow.
I think it starts from
Yeah,
the
so
hypothalamus. Yeah. Tell me.
yeah, so the answer is C.
Yeah, the answer is angiotensin.
Yeah, because
So,
it's secreted from the liver.
yeah. No.
Okay, which of the following ions has the lowest intracellular concentration? Isn't it supposed to be potassium? Intracellular is what's in the the plasma, right?
Yeah, that's true.
So
No,
isn't it
no.
supposed to?
No, intracellular is
Oh,
within.
sorry.
Yeah,
Okay.
yeah. So
Then
inside the
that
cell.
shouldn't that be sodium? Because sodium is.
Yeah, that's what I was thinking.
But we can check.
Yeah, I think we should. I think we should, even as you're asking the question, I don't think we should necessarily be the one who's checking. Maybe all of us can check as you go through the questions to avoid us taking much time. No. So here, sodium and chlorine concentrations are lower inside the cell than outside. Yeah, so I think, and potassium usually has the highest.
How comes whatever Divya has searched, it says the cation with the lowest intracellular concentration is potassium.
But isn't potassium
You
inside
know,
the cell?
no, I think maybe what do you call them? You know, like maybe the way people just answer questions. I think on the side, you should, because I think these ones are usually just answers from people's opinions, if I'm not wrong. Can you open a Google search? You see, like these are just contributions from people.
Actually, I'm seeing that magnesium is the answer.
Or magnesium is the answer.
Yeah.
The lowest intracellular.
Either magnesium or sodium.
Can someone, is everyone checking or it's only us? That we can
No, we are checking.
Sour. Thank you.
It's sodium.
It's sodium.
Yeah.
So I think we should really be careful.
Yeah.
Yeah. So,
Okay, so which of the following is not true concerning adrenaline? It is synthesized by demethylation of noradrenaline. That is true, right? Yeah, I think that's true. It goes from noradrenaline to adrenaline. But I'm not sure if it's demethylation, but let's see. It increases coronary blood flow. It increases free fatty acids in the blood. It mobilizes glycogen stores from the liver.
okay, so here I'm seeing it's
I don't know. I think
it's
it's.
methylation
I
of
think it.
adrenaline. Oh,
Yeah.
sorry. Yeah,
No.
yeah,
Mm-hmm.
go on. I'm sorry. Yeah, but you're right.
Okay. So I think the answer is C, because it doesn't increase free fatty acids in the blood. I mean, it's adrenaline, so like it tries to what do I say? It tries to work up your energy stores. So, like fatty acids is an energy store, so it doesn't try to increase free fatty acids in the blood.
But
It
Mitch,
tries to work it up.
I'm
I think
we
the answer is
wanted
C.
to increase our energy levels, wouldn't we first of all remove the stored fats and then turn them into free fatty acids within the blood?
Mhm.
Ndo sasa tukuwe na an energy source present which can easily
But
be broken
what
down.
is the first energy source in your body?
True, but I'm just
Carbs.
saying
Sindio.
even uh-huh.
Carbs are the first energy source of your body. Sindio.
Mhm.
But
So like
even
if you wake
A,
up, okay, like I feel like C is the answer because it doesn't increase the free fatty acids in your blood. Like it's adrenaline. It should be like it's supposed to stimulate you so that you use your energy. Free fatty acids is a source of energy. So why should it increase?
I'm saying PNMT is the terminal enzyme in catecholamine biosynthesis. It performs transmethylation of noradrenaline to adrenaline.
Okay, so
Using
Will, what do you think the answer
S-adenosine.
should be?
I think the answer is A, because here we're saying that it synthesizes by demethylation of noradrenaline. But according to sources, a methyl is transferred from noradrenaline to adrenaline. So, like, there's a methyl donation occurring for adrenaline to be formed. The way I was saying, in terms of free fatty acids, even when we don't have carbs, we'll eventually start using fats, and then during starvation period. And then if we don't use fats, we'll eventually use our proteins. Or what do you think? Like, I honestly don't know. I'm just trying to contribute to the easy answers during the day of judgment. What do you guys think?
Sorry, Sam had raised his hand. Maybe.
Yeah. Just Sam, just freely talk. Tell us.
So actually I agree. The answer is actually A, because for C, adrenaline is actually involved in the process of lipogenolysis. So that is basically when we're breaking. Yeah, we're trying to break down the stored fatty acids and releasing them into blood. So adrenaline is usually one of the hormones that are involved in that process. But for A, as you explained, it's actually we form adrenaline by adding a methyl group, not removing a methyl group. So we are adding a methyl group to noradrenaline, which is norepinephrine, then we form adrenaline. So we don't remove the methyl group. So the answer is the false statement.
I think so.
Okay, so next question. Which of the following statements is not true about human pituitary gland? Lies in the hypophyseal fossa of the sphenoid bone, derives its blood supply from the circle of Willis, has a neural connection with the
pineal body.
Oh, I can't even see that. Has what independent vascular systems from the anterior and posterior lobe? I don't know anything about this.
I've seen it's in the hypophyseal fossa, so I think that one is okay. The way I'm seeing it here, it's saying the pituitary gland is well vascularized and gets its blood supply from the hypophyseal portal system with a superior hypophyseal artery. So that's not bad. Or yeah, and the posterior from the inferior hypophyseal arteries, which communicate with the internal cardiac. And the like the way I said it, I think it has the D is correct because the anterior and posterior receive blood supply from different, and A is also correct. Maybe someone can check on C, but I don't think it gets its blood supply from the circle of Willis. I think the circle of Willis only supplies like the lobes, but I'm not sure.
Okay, so from what I've just searched, the circle of Willis encircles the stalk of the pituitary gland and provides communication between the blood supply of the forebrain and hindbrain. Yeah, that's what I've gotten from Medscape.
Yeah, that's exactly, yeah.
Yeah,
So I think,
go ahead.
no, I cut you off, I'm sorry.
No, it's okay. You can go ahead.
Yeah, so I think the answer is B, if from what you're saying. Sito, what do you think?
Yeah, I think so too.
Oh.
Anyone else? Then we move.
In number 7, which of the following statements is true about the hypothalamus? It forms part of the midbrain, has a nerve connection with the anterior lobe of the pituitary gland, contains the tuber cinerum, forms part of the roof of the third ventricle.
So I've checked, I've seen I think I've seen B and I've also seen D. So maybe you can check A and C.
You said you've checked what?
I've seen that, oh, it's saying which is true. Oh, let me check again. I'm seeing Um,
I think it's C.
Tuba cinerum.
Yeah. So A, like it's located in the ventral brain, and it's above the pituitary gland, and it's below the third ventricle.
Mhm.
So if it's below the third ventricle, then it doesn't form part of the roof of the third ventricle. So even D is not correct. So it's either B. Somebody check for B.
Yeah, here I'm seeing what you're saying. I'm saying tubal cinerarium is a hollow eminence of gray matter. It is part of the hypothalamus. It says the hypothalamus has three major regions: anterior region directly above the optic chiasm, tuberoid region, which includes the tuber cinerarium, and the third, just a bit, and the third region, which is the posterior or mammillary region. So the answer is C. But I think maybe we can also, and then for B, the way you're saying, I just saw there's a blood supply from the hypothalamus to the anterior lobe of the pituitary nerve connections.
But this is talking about nerve connection.
Yeah, that's what I'm saying. Like I didn't see anything about nerve connections. Maybe we can if anyone has any data based on like the hormones which are produced from the pituitary, maybe we can think about it. Maybe someone can share something, and then we'll see. Just give me a second.
Okay, from what I've seen, okay, so your pituitary gland is connected to your hypothalamus through a stalk of blood vessels and nerves. That's the pituitary stalk. Through that stalk, your hypothalamus communicates with the anterior pituitary lobe via hormones, not nerve connection, and the posterior lobe through nerve impulses. Posterior lobe is through nerve impulses, but the anterior is through hormones.
PPB.
If in case no one heard me, they can just read. Yeah. Okay, let me just close this. Posterior. So we'll go with C. Right?
Yeah.
Okay, so which of the following hormone is secreted by the posterior pituitary gland? It's B. So posterior pituitary gland only, it has like two main hormones that it releases, which is oxytocin and vasopressin.
Yeah, true.
Okay. Which of the following is not a function of angiotensin 2? Increases the release of aldosterone, reduces renin release from the kidney, increase vasodilation, increases plasminogen activator.
So here I'm seeing it causes increase in blood pressure, increases renal tubuli to retain sodium and water, and stimulates aldosterone release from adrenal gland. So from like the RAS system, when angiotensin 1 is converted into angiotensin 2, like the main thing is usually we want, like an increased blood volume, and I think also, increased pressure. So I think C is the correct answer, because then we'd want vasoconstriction. And that's why, let me just leave it there, but yeah.
Why does it reduce renin release from the kidney? Like, isn't renin like part of the...
Maybe I'm thinking it can be negative feedback, because when you look at RAS, it's like renin, aldosterone, angiotensin system, something like that. So, or what do you think? I'm
Yeah,
not sure.
yeah, that makes sense. Like, I know it doesn't cause vasodilation, but like I was also thinking about like how it affects renin. But yeah, that makes sense with negative
Here I'm
feedback.
saying angiotensin regulates renin secretion through a homeostatic mechanism that has been called the short feedback, with renin system and secretion inhibited by increase in stimulation or by reductions of fatigue. Yeah, so I think when angiotensin reduces in concentration, then now we have an increase in renin to boost the angiotensin. So when we have high angiotensin, it will then act like a feedback mechanism to reduce the amount of renin released.
Okay. And since we're on this question, you just have to remember that aldosterone works in the distal convoluted tubules of the kidney.
Yeah, true. Maybe you can also share their function.
Yeah, so aldosterone is the one that increases like sodium reabsorption, and then angiotensin also stimulates the secretion of ADH, which now absorbs water.
Yeah, and I think even in itself, like when the ions are moving in the body, they'll also follow, like water can also follow the ions, to
Yeah.
like they also, yeah.
And then like then the opposite effects of angiotensin 2 is this ANP and BNP. Now they do the opposite effect of angiotensin.
Sorry, can you say them in full?
Let me just write it down. I've put it on the group ANP, which is released from the heart, which does the opposite effect of angiotensin. Okay, so Langerhans cells are found in the lymph, skin, lymph nodes, ovary, arterial lymphoid sheath. Aren't they found in the pancreas or something? Or I'm confusing it with something else.
No. They're found in the pancreas.
Nini, see, I think it's this Langerhans cell, the dendritic cell that Stano was talking about, the immune cell. So, and they are usually found in the skin, those dendritic cells.
Oh, okay.
Yeah.
Okay, then the plasma membrane is composed of D, partly lipids and proteins, we know that. Histology is the study of living organism at tissue level. Tissue or cell?
I feel like it's tissue,
Okay.
but we can always search.
Yeah.
Yeah, it's tissue, because cell is cytology.
Yeah. Biological tissues, yeah. Just a minute.
Okay.
Cytology. Okay.
How many possible? What is that? How many possible phenol types are there?
Phenotype.
Oh, phenotypes are there in ABO blood group?
Did we do blood groups? I can't remember hemat, to be honest.
We did the whole A, B, and O.
No, in the discussion with the class. Did we do it?
I think so.
Okay.
I think
So
it was
they've-
mentioned somewhere.
Okay, so there are four basic ABO phenotypes. There's O, there's A, B, and AB. So the answer is A.
Yeah, and then the genotype is now what's different. Like that is, I think it's like A, B, or A, B, and O. I don't know. I'm not sure how.
Oh yeah, it's that one where there's A can be either in AA or AO, is it? Yeah.
Okay.
Then if about B can be BB or BO, like that.
Okay. Yeah, so that makes it 6 possible genotypes.
Yeah.
Okay. The creation of mutations is called mutagenesis. Which part of the brain regulates body temperature? We know it's hypothalamus. Anybody know the functions of the other three?
Cerebellum is for balance.
Mhm.
Medulla oblongata. Can someone also share? Can someone also share the like how maybe someone can remind us how the hypothalamus regulates blood body temperature, please?
So apparently, medulla oblongata helps control vital processes like heartbeat, breathing, and blood pressure.
I think hypothalamus was the one which like causes the skin hairs to like raise and stuff like that. Ama, maybe I'm saying my own things to trap air to prevent, like to protect us from the cold. Can't remember those other functions. Maybe if someone remembers, please share with us.
What was your question, Willie?
I was asking if someone remembers like how hypothalamus, does those how it regulates body temperature, if you remember.
Hey, Willie, at how the hypothalamus regulates body temperature?
Yeah, that's what I'm asking.
Oh, how?
Not effect on the sweat.
How?
Like it
Oh,
signals
yeah,
glands,
Shafi, yeah, true.
the sweats, or I don't know. I don't
Yeah,
know.
you're
Maybe
yeah, you're right. Yeah. I was also saying like raising the hairs to trap air if like our body hairs to trap air if it's cold. Maybe if someone remembers other points.
it also could, like when it's cold, it causes vasoconstriction of the blood vessels near your skin to reduce heat loss. And then it does the opposite when it's hot. So it causes vasodilation so that heat is lost from your body when it's hot to lower the body temperature.
True. So I think those are enough. Does anyone remember the function of the thalamus?
Thalamus is basically like a relay station. It like passes all the information to, I think, the cerebral cortex, but I'm not too sure.
I'm also seeing the same from Google. Except all the body senses except smell to the cerebral cortex for interpretation. And it also plays a role in sleep, wakefulness, consciousness, learning, and memory.
Okay. Okay. The immunoglobulin with the least concentration in the serum is IgD. Which of the following cells is not phagocytic in nature?
The B lymphocytes.
Yeah, because microglial cells are a type of macrophages found in the brain. So even I think it's B lymphocytes. Okay. Which of the following statements about rheumatic fever is true? It's a complication of beta hemolytic streptococcal infection. It only affects the elderly. It complicates 3% of acute sore throats. It shows no evidence in genetic susceptibility. A, right? I think streptococcus is the one that causes rheumatic fever.
Yeah. The beta hemolytic.
I'm seeing it's group A, not, or it's the same. I don't know.
So it's not the same. Then if it's not that, then it's something else.
No, it's the same. It's the same. It's group A beta hemolytic. So yeah. It's
Okay. Which of the following does not predispose to superficial Candida albicans infection? Pregnancy, lymphoma, diabetes, and vegetarian diet. How does pregnancy cause? I'm not sure about that one.
I think pregnancy could be hormones. The increase in estrogen or something.
When you're pregnant, your immunity is compromised as well. Then?
Oh, okay. That makes sense.
But the question is asking, does not predispose. But yeah, I agree with Sophia.
So B is the correct answer.
Vegetarian diet? I think it's D.
Because I mean, even in lymphoma, your immunity is compromised. Yeah. But even in vegetarian diet, I feel like some of these foods, I don't know, can come with
I'm seeing here like risk factors that promote candidiasis, where there's immunosuppression such as diabetes, dentures, steroid use, malnutrition, vitamin deficiencies, and recent antibiotic use. So I'm wondering, does like a vegetarian diet fall within our classification for malnutrition or maybe vitamin deficiencies? What do you guys think? And I'm also seeing most people who get candidiasis in the esophagus have weakened immune systems, meaning that their bodies don't fight infections well. This includes people with HIV and people who have blood cancers such as leukemia and lymphoma.
So B cannot be the answer.
I think the answer is D.
D, yeah?
I think so.
Also, I can see here eating a diet high in refined carbohydrate, sugar, and yeast can increase candidiasis.
But this one is asking for vegetarian diet.
Oh,
Yeah.
yeah, that's the answer.
Everyone okay with the answer? So we can move.
Here I'm also saying during pregnancy, women often get oral thrush because of changes going on in their body, especially during the third trimester. Yeah. So I think the answer is D.
D. Okay.
Okay. Which type of cell is involved in the initial presentation of antigen to T lymphocytes? Yeah, A makes sense because dendritic cells are antigen presenting cells. Which are the cells that antigen presenting?
Yeah, antigen presenting cells, certain lymphocytes such as the T cells. Classical APCs include dendritic cells, macrophages, Langerhans cells, and B cells. I'll repeat, classical APCs include dendritic cells, macrophages, Langerhans, and B cells.
Okay. Which of the following types of cells produces IgE? Plasma cells are the only ones that produce antibodies, so it is C. IgE acts on mast cells, right?
Yeah.
Yeah, true.
Okay. Type 1 hypersensitivity clinically involves which of the following? Yeah. So yeah, IgE also. Type 1 is the IgE. Type 2 is usually IgG and IgM. Type 3 is also mostly IgG. Yeah. Then type 3 IgG. The protective effects of breast milk are not associated with. I'm not sure about that one.
Divya, maybe you can display the picture Letting sent to the group that had all the vaccine and what types of vaccines they were. Yeah, so that we cover that here. Now that we didn't cover it when we were reading.
Do you have it on your laptop or something? Because I don't think I have it on my laptop.
Right now, I'm on the move. I don't even have my laptop right now.
Okay.
Okay, someone else, or it can be reshared on the group. Someone can highlight it.
What Mercy had sent, yes? Okay, let me just see if I can highlight it. You're talking about the vaccines, yes?
Yeah, the vaccine.
Okay, I've just resent it. But we're still on number 23 though.
Okay, let me share it. Stop sharing. I cannot share the screen.
Fatma, you can share.
Yeah, I'm sharing.
Guys,
Hello.
yeah, it's been displayed.
Oh, see, we are just revising and seeing which one is live, which one is whatever inactivated, and then we go and look at the guidelines and see when they are doing that. If you see 06, whatever, such thing, like you can just take them through. Because right now I'm at the pharmacy, I can't be on my phone throughout.
No, that's okay. I thought you wanted to say something about them.
See, we can go back to the questions. We see what the actual question was. Okay, so for number 23, has anybody found anything?
Okay, from from what I've seen, IgE, basophils, mast cells, eosinophils, and the mediators from the cells are absent in human milk. That's what I've seen. And then IgA is present. I'm not too sure about lysozyme and the CD4 cells.
Okay, so mast cells. Okay, which of the following is a live vaccine? From the picture that you sent, BCG is the answer. Okay. A 42-year-old male. What is that? A 42-year male what?
Severe, a major artery during an accident, and is estimated to have lost about 800 mils of blood. His blood pressure is 85 or 65 mmHg. A decrease in the the following would be expected in response to hemorrhage in this man.
I think the heart rate will increase. I also think the learning activity will increase. From what we see now, vasoconstriction and increased blood pressure. I think we'll also want an increase in. I think we'll also want an increase in sympathetic activity, obviously, because adrenaline will increase blood pressure via the various means. I know the vagal nerve usually deals with stuff with the diaphragm, so maybe someone can check if what we'd expect. But normally when I think this person would want to take deeper breaths, but like for longer periods than, so that they can absorb more oxygen compared to like quicker breaths, because it's not the same as like when he's tired. So I think the answer is D. What do you guys think?
If he's lost all that volume of blood, that means the cardiac output is also decreased. I'm thinking.
But like as a response for his body, I think the cardiac output would now increase. See, because it's the expected response. So if he's lost a lot of blood, I think the heart would start beating faster. Or what do you think?
I don't know. The heart rate would be less in this case. Yeah,
you think the heart rate would be less as a response or initially? Because now I think the body is trying to compensate because now you have less blood and like you still have the same body. So I think one way which you can compensate is by, first of all, increasing the amount of oxygen that you have within the blood itself, and also increasing the heart rate. But then I'm not very sure because
the point of it is a compensatory mechanism. So that's it seems almost counterproductive, because then you'll be losing more blood. You've already lost more.
I'm not, but I don't know. Who else has a different opinion?
So, Willie, so what do you think? Which one are you going with here?
I was thinking maybe D.
Yeah, for that I'm going with D.
Yeah.
Because D will cause a decreased cardiac output and also a decreased heart rate. And when someone is injured, especially massive blood loss, cardiac output is increased. As you're just saying, I'm just supporting. Cardiac output is increased because since the organs are lacking enough blood, they tell the heart, and the heart doesn't know that you're injured, so it pumps more and more. So I'm supporting the vagal nerve.
Yeah, that's what I was thinking. And then I was also thinking, because the vagal nerve supports like the diaphragm and everything, you would need it to have less activity so that you can take deeper breaths to increase the amount of oxygen which is absorbed via the lungs. No, what do you think?
Yeah, yeah, yeah. Okay, that's yeah, but okay, now support the goal. I don't know about the how if you with the diaphragm, if that's also a reflex mechanism by the body, but it's an advantage.
Awesome, thanks.
Okay.
And
A
it-
15-year, sorry, a 15-year-old boy is subject to recurrent attacks of asthma. A careful clinical history reveals that the asthma diclofenac administration, which of the following is the pathogenic mechanism in this form of asthma?
For diclo, it will be inhibition of cyclooxygenase pathway.
So C. Okay. Which cellular adaptation describes an increase in the number of cells in response to an increased workload? Hyperplasia. Hypertrophy is increase in size. Atrophy is decrease in size.
Let me ask
Hyperplasia.
you.
Mhm.
Atrophy. We don't say atrophy is cell death. So, it's decrease in size. What is cell death? What do you usually say cell death is?
I think atrophy is like is related to size.
Yeah. You're right. I'm sorry. So,
And then metaplasia is, I don't know.
metaplasia is the replacement of one differentiated somatic cell type with another differentiated. So it's just, triggered by environmental stimuli.
Okay. So hyperplasia, because that's related to cell number.
Yeah.
Homeostasis can be defined as functional changes caused by disease. No. An unbalanced state of equilibrium. No. A steady dynamic state of equilibrium.
Hiral,
Yeah.
sorry, that question 26. Why did you guys
Uh-huh.
choose the inhibition of COX pathway?
See, diclofenac isn't it a COX inhibitor?
Yeah, it's an NSAID, but in this case, see, it directly releases the bronchoconstrictors modulators. Because does it lead to bronchospasm or what?
Hey, Shafi, on that, Nini, generally, NSAID, because of this thing, thank you. Aspirin-induced, what do you call it? Aspirin-induced asthma or whatever. There's what aspirin does, and it's an NSAID. It inhibits the COX pathway, right?
Yeah.
And now, okay, taking you back to the COX pathway, it starts with the membrane phospholipids. They go to arachidonic acid. Then from arachidonic acid, we have the COX pathway. But if if the arachidonic acid doesn't follow the COX pathway, it will follow the LOX pathway, the lipooxygenase pathway. So that lipooxygenase pathway leads to production of these leukotrienes, and leukotrienes will be involved in that an asthma attack. So that is how aspirin or NSAIDs in general cause the asthma. It's because once you inhibit the COX, it means we have the LOX pathway is upregulated. So we have release of these kinoleukotrienes. Yeah. So it doesn't cause a direct release of the mediators, it's an indirect release because it's through inhibition of COX. So LOX is working more. When LOX works, we produce leukotriene. Is it leukotriene? Lipooxygenase. Yeah, it's leukotriene. So leukotriene will cause bronchospasm. Yeah,
Okay.
so that's why I was thinking of COX. Yeah.
Thank you.
Okay, cancer is on the rise across the globe. Which term describes this phenomenon? Pandemic, because it's all over the world. Which of these diseases is caused by? Is that protozoa?
Yeah, it's a protozoa.
Okay, so we know
Yeah,
giardia.
protozoa.
Giardia is caused by giardiasis is caused by Giardia lamblia, something like that. Then the use of plague is caused by what?
Plague is caused by bacteria.
Yeah, Yersinia
Okay.
pest.
Yeah.
Mumps is
Yersinia
caused.
pest. Yeah.
Divya, just type that.
Mumps is a virus.
Yeah, mumps is viral. Then brucellosis again, we have bacteria.
Okay.
Yeah.
And the first one you say it's caused by plague is caused by which particular bacteria?
Yersinia pestis. Let me just type it.
Oh, okay, fine. Okay. The use of controlled heat to reduce the microbial population in milk and other heat-sensitive liquids is called, pasteurization. Which of the following bacteria is associated with the peptic ulcer diseases? Yes, H. pylori.
For number 37, can we autoclaving? What was the temperature and the time? Because we didn't revise this when we were looking. So there was it 121 degrees Celsius?
Yeah, it was 121, but I don't remember the time.
I think time is 30 to 60 minutes.
And the temperature is 121 degrees.
Pardon, Divya?
It's usually an hour, half an hour to an hour autoclaving.
Or 30 to 60 minutes.
Yeah.
Sorry, Samuel, you're saying 121?
It's usually 15 psi, that is for pressure, then 15 minutes for the time, that is at 121 degrees Celsius.
Okay, yeah.
Yes.
Welcome, Sam. Kumbe, let's continue.
Okay, since we're on H. pylori, treatment of H. pylori. It's like a common.
Isn't it PPI?
Okay, first we can look at Divya?
Isn't it PPIs and antibiotics?
Yes.
Yeah,
It's
but
usually
which antibiotic?
Clarithromycin.
Yeah.
amoxicillin and a PPI.
And if someone is allergic to amoxicillin,
The hell is this?
for those with allergies, we give metronidazole.
Clarithromycin ama amoxicillin.
In place
So you
of
give
amoxicillin, we give metronidazole.
What do we use, Lama?
Yeah. Then just
Ati?
a revision.
Oh no, ilikuwa nimesikia
Hizo
nikaa chai tumike.
macombination sana kina levofloxacin.
Yeah, okay, kuna the likes of level. Those ones are hybrid therapy when mtu try these others. But okay, we look at those more when we are doing clean farm. But yeah, kuna levofloxacin can be used, all of those. But essentially, it's a PPI plus antibiotic. Then just an overview of H. pylori. It was a gram-negative spiral-shaped organism, or it was curved, right? And one of its virulence factors was the release of that enzyme urease, which was breaking down urea into ammonia, and ammonia was buffering the acidic pH. So yeah, just an overview. It's pylori. Gram-negative, spiral shaped, contains that urease, and we were testing it using the stool or the urea breath test, right?
okay. The causative agent for Kala-Azar is
Sorry,
Leishman.
PPIs like pantoprazole, ama? Pantoprazole or ama? Do you guys have a
I
specific?
think mostly they, like, for H. pylori, they usually have the H. pylori kits where I think mostly it's esomeprazole.
Not esomeprazole. Okay.
Yeah, isomeprazole, and others have the lansoprazole, but generally just a PPI, because many there are people who even buy the H. pylori kit as individually. They'll buy an omeprazole on its own, a wart on its own.
Okay. I hope you guys can read notes when I send the paper.
We hope so too, Divya. We hope so too.
All right, next.
Okay. The causative agent for Kala-Azar is Leishmania, Kala-Azar,
we have Leishmania. Then the Leishmania, what was the vector for Leishmania? Because we didn't do it. Which animal?
Sandfly.
The sandfly. Nice. And then Leishmania, they were called mastigotes. They were majorly affecting the macrophages. The macrophages. They were living inside the macrophages. That's why when someone was having this visceral, because, okay, just a revision, there were 3 types of leishmaniasis, right? Cutaneous, the one that will be on the skin. There will be the mucocutaneous, skin and mucous membrane, right? And lastly, visceral. And visceral is the bad one. And it's the one that is also the Kala-Azar. And with visceral, we'd see also the enlargement of the spleen and of the liver. Remember, we said the spleen has a large concentration of macrophages also. So, yeah.
Yeah, and then since we're on this question, Trypanosoma cruzi is caused by the rewooded bug fly, something like that. R-E, wooded, yeah, bug, and it causes the Chagas disease. Giardia causes giardiasis, and E. histolytica causes amoebic, which is the intestinal and the extra-intestinal amoebiasis. Yeah. Okay, so the vector for Wucheria bancrofti is mosquito. Sassafly is caused by it causes the other trypanosoma, which is the Trypanosoma brucei, the rhodiense and gambiense, which is like the East African sleeping sickness and sleeping sickness basically. Yeah. Okay, which of the following disease is caused by a bacteria? Leprosy, yeah. Yellow fever is also caused by a virus, right?
Yeah, yellow fever is a virus. Then for Nini, what about snails? Which disease Which disease is associated with snails?
I know snail is an intermediate host in is it schistosoma?
Bilharzia.
Yes.
Which one?
Bilharzia, the schistosoma.
Yeah.
Rat plague.
Sorry, rats what?
And
Plague.
The plague.
Yeah.
Yersinia pestis.
na dengue fever ni same na hiyo ama ni different?
Sorry, what, Mercy?
The dengue fever
Mm-hmm.
caused by rats.
Oh, dengue is rat.
It's not flea.
Ama it's fleas on rats. I don't know.
I thought it was fleas.
You know it involves rats.
I think it's dengue, isn't it? Mosquitoes.
Even me, I thought dengue is mosquito.
Yeah, it is.
Okay.
Rats, I
Yeah.
think rats is majorly just the plague.
Yeah, dengue is caused by mosquitoes.
Dengue.
Oh.
Okay, a patient wants to know what caused his illness. This information is termed as etiology. A patient is diagnosed with congestive sorry? Okay, a patient is diagnosed with congestive heart failure and is told that she has 6 months to live. This prediction is referred to as prognosis. Which type of spinal cord injury is associated with the clinical manifestation of ipsilateral loss of motor and sensory functions? I don't know this.
Brown.
Yeah, true. I'm seeing here that Brown skewered syndrome, motor loss on the ipsilateral side of it.
Yeah, there was a place where okay, some of us had seen this was the answer, also known as spinal shock syndrome. But you guys can go to, I can't find the article right now, but when I do, I'll send it to the group.
Okay, a 76-year-old female presents with complaints of difficulty in reading. Ophthalmologic examination is remarkable for bilateral white opacifications in her eyes, consistent with cataract formation. In which of the following structures are the opacifications located?
I think it's the aqueous humor. Those are like those small white things just what do you guys think?
I thought the lenses. I'm not sure though.
Yeah, I'm with Jambi on this because even when they do surgery, it's the lens they replace.
Yeah, that makes sense. Okay, which of the following viruses is a retrovirus? C. Okay, which cancer does that virus cause? Is it one of the leukemias?
Which one?
Which one?
Epstein-Barr.
I know Epstein-Barr virus is associated with
Bucket's lymphoma.
Burkitt's lymphoma.
sorry, I can't.
Bucket's lymphoma.
And then for this human T lymphocyte viruses, it causes acute lymphoblastic leukemia. Okay. Which one of these following organism causes syphilis in men? Treponema. Yep, that's the answer. I can't read that question.
Which one of the following bacteria contributes to the normal flora of the intestines of man? E. coli.
E. coli.
Yeah.
Which?
Sorry.
Oh, it's okay. All the following organisms cause UTI except okay, so I'm seeing C doesn't cause UTI, it causes intra-abdominal infections. The others, I know E. coli does cause UTI, but I'm not sure about A and D, but C can be the answer. The 4 most abundant elements in living organisms are, yeah, that's the answer. Which of the following statements is false about enzymes? Cellular catalyst.
I think B is the answer, because they usually catalyze specific reactions. Like each enzyme is usually for a specific reaction. Remember, like when we did the lock and key, so like the key can only fit in a particular lock. So no.
Yeah, that makes sense.
It actually makes sense. But what about choice C? For enzymes are required in large amounts or large numbers, sorry, in a cell.
But is it really required in large numbers? Because it's like when it catalyzes like a specific, like if, for example, glucose is phosphorylated, it leaves the enzyme site and then another one comes. Does that make sense?
Yeah.
But for that, okay, because also me, I'm thinking the same as Sam, though I'm agreeing that the answer is B because enzymes are highly specific, but enzymes are also recycled because they form the enzyme substrate, enzyme product, then the product goes and the enzyme is recycled. So I don't think it's needed in a high concentration or it's there in high concentration inside the cell. But the best answer, I'd still go with none. They catalyze non-specific because they are very specific.
Okay.
Yeah.
Okay. The 3-dimensional structures of biomolecules like proteins, polysaccharides, and membrane lipids are held together by?
So for this one, it's anything with ionic is out. Ionic is just off. There is no ionic because an ionic bond is so strong, and we know for enzymes or even for proteins they change their structures. So it would just be
B. Hydrogen bonds and van der Waals interactions.
yeah, and van der Waals, yeah.
Okay. Which of the following amino acids have an aromatic R group? Yeah, we know the 3 aromatic amino acids, which are those. The following polysaccharide are physiologically important carbohydrates except
Mm, is inulin absorbed from the body? I remember, I think Paul saying something that it can't be absorbed or something.
yeah, there's something like that.
Yeah, because we learned it's the best indicator for kidney function, but the fact that it can't be absorbed makes it kind of maybe
I'm saying
someone can just
inulin is a
Google on
water-soluble
inulin.
polysaccharide. Inulin is a water-soluble polysaccharide and belongs to a group of non-digestible carbohydrates called fructose. And the way you're saying, I think it's true because ndo maana inatumia kwa hizo matest because then it won't be absorbed. Yeah. So it's a non.
Okay.
So it's even like a type of prebiotic. So it can be used as a prebiotic because it's not absorbed.
Oh yeah, true. Yeah, it's not digested.
Since it stays in the bowel, so
yes,
it's used as a prebiotic.
What about anything about inulin with kidney function? Like
Divya,
from what you've seen.
Sorry?
With kidney. Anything about inulin related to testing kidney function or something
is the
like
most
that?
Yeah, it's useful for indicator that when there's low rate of glomerular filtration rate, it's indicated in the inulin. Like it's like it has capacity to detect like the filtration rate of the kidney. If like the capillaries and if they have maximum rate of filtration. So when you have low GFR, it can be detected from the inulin. That's its relation to the kidney. I don't know any other relation.
Yeah,
I don't know.
I think
Yeah, so under which class of lipids does sphingofospholipids fall? Complex. The following two enzymes are used to phosphorylate glucose-6-phosphate, hexokinase and glucokinase. Yeah, because those are the first enzymes in glycolysis. And then I have a question. Glucokinase is the one that has a high Km compared to hexokinase.
To the liver, hexokinase is found in all cells in the body, and it has low affinity for glucose. So glucose has to be present in very tiny
Okay. So it's glucokinase that has a higher Km, right? Because it needs higher glucose
Yeah.
concentrations.
Yes.
Okay.
So a higher Km means a lower affinity.
No, not necessarily. A
Yes. Higher
higher.
Km, low affinity.
Okay. Okay.
Okay.
Wait, you said it needs more glucose.
Yeah, like
Yeah,
it's only
so
active is high concentration of glucose in blood.
Okay.
in which type of, is that for what?
Porphyrin.
Oh, porphyrin. In which type of porphyrin does darkening or porphyry does darkening of urine occur upon standing and the patients do not have normal sensitivity to light? I don't know that one.
This one, Sam can help us. Some are copy. Sam is an expert.
Yeah. But if it's the variegates, I'm not.
Sorry, you said what?
I'm not really sure. You can just confirm it, but I was to go with variegate, but I'm not sure.
Okay.
You guys see the chat?
Yeah. We've seen the chat from 99.
So it's A, not, I thought it was D.
According to the chat, it's A.
Okay. Which chart are you talking about?
The chat.
Oh, chat.
Yeah.
Okay. Because I also saw that this variegate porphyria, it also causes like sensitivity to light.
But the question is asking do not have.
Oh, okay. Sorry. Okay.
Okay.
The main function of insulin hormone is to decrease blood sugar. Ascorbic acid is an oxidizing agent. Acts as an oxidizing agent. Yeah, because it's an antioxidant. The following are basic cell types in plants except. Yeah. Which of the following does not qualify as a crude drug? Yeah, senna leaves. Crude drug is watch now that you've whatever you've extracted. The following are characteristics of leaf margin except.
Excuse, I think the answer is strychnine for this particular. Senna leaves are actually a crude drug because they're basically a part of the plant, but strychnine isn't a part of a plant. It's actually a phytochemical. And if you were to compare tragacanth, Actually, okay, I'm not sure about tragacanth. So it's a gum, so I'm not really sure if it's. We could actually confirm because tragacanth. I'm not sure if it's a drug. It's actually a gum. So,
Okay, question. When they say
but
crude drug, what does that exactly mean?
I think it's just a part of a plant before it's processed. Basically, the only process that it undergoes is cutting, crushing, and drying. Something of the sort.
Oh, okay.
You could just confirm.
Okay. The following are characteristics of leaf margin except this is a botany. I don't know this. I'd go for D. Slate.
Answer strychnine. I'm not sure if it's strychnine, but I'm pretty sure it's not senna. So it could be either strychnine or tragacanth. But okay, strychnine could be the most likely one because it's a phytochemical.
Okay.
I'm not sure if
But
you
it makes
confirmed it.
Wait just a minute. Yeah, I think it is C. Tragacanth.
Okay.
Yeah, I guess. Yeah, I think so. Okay. Which of the following plants gives rise to a fiber?
Oh, yeah, so maybe I can just do something. I'll just read the definition of drug. So they're saying it's actually a natural substance that has medicinal properties and has not been refined or processed. It can come from plants, animals, microorganisms, etc. So basically, they're saying it can be in various forms, such as a whole or powdered extract. So yeah, for that case, senna leaves is actually a crude drug because it's basically the leaves which you're using in the whole form. So strychnine would actually be the answer.
Okay. Okay. Chai, you're saying isn't C a poison? For which question?
55, yeah, it's actually a poison.
Yeah. Yeah, okay. The
Hey, you guys,
okay.
let's go back. Someone has said, sorry, Sarah has said ascorbic acid is a reducing agent in the
Oh,
group.
really?
Because it's an antioxidant, so it prevents, if it's an
Oh,
antioxidant, then it prevents the action of oxidizing agent. So
okay. Okay, fine. Sorry about that. Okay. Which of the following plants gives rise to a fiber?
The correct answer is actually A because it's cotton, which is the fiber.
And the rest are, if you probably know.
I'm not sure what other those plants are, but it was doing this, told us is tobacco. So tobacco isn't a fiber. So I'm not sure what B and B.
Okay, what I'll do is I'll search and I'll type it and I'll send it to the group. We can just move on to the next. That's okay?
Okay.
Yeah.
Yeah. The following is a structural classification of glycosides except I think B, because we just have steroidoglycosides, cardiac, and cyanogenetic. We don't have, there's no steroidal.
But okay, Nani Hiral, just asking now, because it has the question is asking structural classification based on structure. Cardiac glycosides, see, that is based on function. Like just even for example, why not C? In short, I'm asking why not C? Because if we are saying cardiac, that means it's a function. Like I'm seeing
that
the
also makes
steroidal
sense.
alkaloidal, yeah, I mean, we've not seen that classification, but why not C?
Cardiac, we have things like digoxins, isn't digoxin? We all know the structure of your digoxin, and yet it's a cardiac glycoside. Yeah, so I would have also gone with the steroidal alkaloidal because there's nothing like alkaloid glycoside. Even by structure.
I think Gaius, when you're like even the structure, like you're saying cardiac glycosides, right? But you see the main function is to work on like the heart, but it still has that structural feature, like with the glycosides and like cardiac glycosides are classified, like they have a subdivision of cardenolides and bufenolides, something like that. We'll talk about them when we come to phytochemistry. But yeah, I would also go for steroidal alkaloidal. I would go for B because I've not come across something like that.
We've not come across. Yeah, true.
Okay.
Okay. Absolutely. We'll see them when we are doing kina phytochemistry.
Cardiac glycoside, I think they're also called sterol. I don't know.
But for cardiac glycosides, they're actually
Sorry, you're saying, Sam?
For the cardiac glycosides, they're actually of two structures. So I don't think it's a specific structure one mentioned earlier. So yeah, I actually think the cardiac glycoside is more of a functional. Functional class.
Let's search for it.
Does anyone know how to do this? Ama, we're still here.
For number 59, we can say 8 minus 7.1, then you find the antilog. Initially, pH is equals to pK plus the log of the conjugate base over the conjugate acid over the conjugate base. But in this case, since we have the pH and pKa, we can say 8 minus 7.4, and then you find the antilog.
Okay. All the following are acidic organic functional groups except.
That one for the cardiac glycoside, it's also part of glycosides because I'm seeing here like classification of glycoside, it's either based on linkage, based on nature of glycon, based on nature of a glycon, and based on therapeutic activity. So cardiac glycoside is part of based on therapeutic activity. So it's one of the types of glycoside. So the answer is B.
Yeah, I also found some extra information, and they're saying
Okay.
that's
Thank you.
actually exist.
Okay, so we move to the next question.
Yeah, we can move to the next question.
Okay. All the following are acidic organic functional groups except.
Way number?
Is correct. Code 60.
Sorry, I didn't hear. What's the answer?
I'd go with C.
C. Okay.
Yeah.
Yeah, I'd go with that.
Okay, which of the following salt forms has the highest water solubility? Penicillin G, because we know when it's in that form it's water soluble, right? Okay. Which of following drugs exhibit geometric isomerism?
which were geometric isomers first? Was it the kina? We're talking about kina R, S, Cs, plants, or those ones?
Yes.
Yeah, I think so.
Or then the other one was constitutional isomers. Okay. On that note, medchem, ladies, medchem.
Yes, our genius guys. Tell us.
This one I'm leaving it to Sam. Sam is here. I'm relaxed. Yeah, he taught me everything when I was in attachment. But
Question 62.
Yep.
I think that, but you could confirm it.
Sorry, what option?
Ephedrine, because it has an isomer, if I'm not mistaken.
Yeah, it's ephedrine. Okay. You guys want to continue or we continue tomorrow?
Let's just finish with this page. It's just 2 more questions, then we can continue.
Okay. Dissolution of a drug particle is controlled by all the following except. How does isomerism affect dissolution?
I think it's D.
Yeah, I also think the same.
Yeah, I think I would also go for D.
D, isomerism.
Yeah, because I'm not sure how isomerism would affect dissolution, but I'm not sure. Like I would go for D.
Okay.
Anybody else? Okay. All the following statements are true regarding partition coefficient of a drug molecule except it is an indication of the in vivo absorption. It is a measure of the drug lipophilicity. It is an indication of ability to cross cell membrane. B, because it's the ratio of ionized drug, right? Not unionized. I think so, but I'm not sure.
So we stop here.
Yeah, we'll continue from here tomorrow.
You guys.
Thank you.
Have a good night, guys.
You too.
You too.
Wait, Hiral. I think that question is not D.
You're talking about number 64.
Yeah.
It says except.
Except.
Yeah, true regarding partition coefficient except. That's why she chose.
I think it's a ratio of an ionized drug between two phases, organic and inorganic, organic and aqueous. I think the answer is C.
Indication of ability to cross cell membrane. Okay.
Yeah. I don't know if someone agrees with me because it's lipophilicity and it's also indication of in vivo absorption.
Okay, I think yeah, she's left.
Plus why I said it's an ionized because its ability of to move from solute to move in two phases of a solvent. So it's still an ionized. It's not ionized.
Okay.
But see, correct, it indicates the ability to cross the cell membrane.
Does it really indicate the ability?
Yeah, it does. So I think for 64, I think the word unionized, that is what I think makes the answer wrong, but I'm not really sure. You could confirm it, but
Yeah,
C is
because
correct.
what I'm sure of A and B are true. So I don't know. Guys.
Habibi, mambo.
What do you think?
Let me read it. Nilikuwa na client hapa. Mhm. Of a drug molecule. It's not iron, like, okay, it's not D, like because of that word unionized, like just thinking, not sure. Shafi, you are thinking C, indication of ability
Yeah.
to cross cell membrane.
Yeah.
Yeah, I mean, I feel like it's an indication of ability to cross the cell membrane. By the way, no, even that, yeah, that's not true. That can't be also correct. But okay, how about that term unionized? Can we confirm on that? Is it usually ionized or unionized?
It's an ionized.
Or it's an ionized.
Yeah.
So that statement is true.
Yeah, it's
See, then it will be C, an indication of ability to cross cell membrane. Because as much as a drug can be highly lipophilic, there are other factors that can make it not cross the cell membrane, such as the molecular weight.
Yeah.
So, I wouldn't say it's an indication. It's not exactly an indication for me. My thought.
Yeah, plus the solubility also get a factor because the greater the solubility, the higher the partition coefficient.
Partition coefficient. Okay. See, how about we start from here tomorrow? At least assignment